of vulvovaginal infection and vulvovaginal candidiasis. What is also the role of fenticonazole in Gardnerella vaginalis infected mouse models? This is a very interesting question, which is evaluated and studied in this experience, recent experience, so we can account new update about fenticonazole. In this experimental model, it was possible to describe the role of fenticonazole in case of infection sustained by the Gardnerella vaginalis. And very surprisingly, it could be observed that fenticonazole improve the vaginal imbalance, which is described in the case of Gardnerella vaginalis, essentially attenuating the myeloperoxidase activity. And not only in the case of myeloperoxidase activity, but the modulation activity of cytokine involved in the infection. So we can conclude on the basis of this important and very intriguing study that the administration of fenticonazole ameliorated the phenomenon linked to the Gardnerella vaginalis infection, greatly improves the symptoms, and so we have a new property for confronting to the typical comparator with fenticonazole, like miconazole, clotrimazole, and so on. In terms of compliance and what's happening in the case of relapses and so on of the infection, we have to consider the impact of antimicrobial dosing in the evolution of the drug resistance. And by this point of view, we have a lot of in vivo and in vitro data and experience. The data usually demonstrate that the presence of not optimal dosage of drug, for instance, fluconazole, contribute to the strong selection of resistant mutants of the Candida. We consider and stress in particular Candida because Candida vulvovaginitis is the typical model of vulvovaginal infection. We hypothesize that there is a very strong relations affecting drug resistance. Consider the not correct use of antimicrobial. So we need optimizing the antimicrobial dosing regimens to prevent the development of drug resistance, because we have seen what is the impact, the very important impact of the drug resistance. So we have to consider also that we hope to have several characteristics for consider optimal an anti-infective treatment. In absence of a microbiological diagnosis, we need, of course, a broad spectrum of activity. And a broad spectrum of activity allows us to obtain a consistent and high success rate. We need a drug with the maximal activity at the typical pH of the vaginal environment. And this is a problem for the typical competitor, miconazole and clotrimazole, but in the case of fenticonazole is not a problem because we have their optimal activity at this value of pH. We need that there is a persistence of the drug at the level of skin and in vaginal mucosa. We need to contrast the typical and peculiar mechanism of not resistance, but the mechanism of penetration in the mucosa. And this mechanism is the linked to the aspartic acid proteinase, and the unique drug which has an inhibitory activity of this proteinase is fenticonazole. And this kind of activity guarantee a good action and a higher probability to reduce and prevent the relapse, because this mechanism guarantee a higher level of mucocidal activity. And the availability of the formulation with small and soft ovules allow and guarantee an optimal compliance of the drug. When we are looking for a very higher level of appropriateness in the cure of mixed vaginitis, we have to consider the composition of different drug and different approach. We know that to obtain the treatment of the treatment of the mixed infection, we have usually the possibility to use combined treatment. But in the case of fenticonazole, we have just seen before, we have a drug which guarantees the activity against not only Candida and an higher level of non-albicans Candida, but strong activity and bactericidal activity in the case of bacterial and strains and Trichomonas, for instance. So we can consider a first-line treatment of combined and mixed vaginitis using fenticonazole. We have just considered the impact of a prior dosing of the isolation of fluconazole non-susceptible Candida species. And this historical paper consider that nevertheless, the low number of patient study, the higher efficacy of treatment of Candida infection in the case of subjects which were not previously treated with fluconazole. But there is a very important risk of emergence of fluco-resistance strain in the case of pre-exposure treatment with the fluconazole drug. Why this phenomenon? This phenomenon is linked to the different dosage used in the case of treatment of Candida infection. If we use low dosage of fluconazole, we have a higher probability to isolate and select resistant strain of Candida. When we use a higher dosage of the drug, this risk was absolutely lower confronting to the other group of patients. Because we have to consider that if we used a low level and a low dosage of the drug, we can select not only the non-albicans strain, but also the Candida albicans strain, which are programmed to be less sensitive to fluconazole. And so we have to consider the guidelines, the international guidelines for the treatment of vulvovaginal infection. All guidelines consider the dosage of 100 or 150 of fluconazole as the gold standard of the treatment of vulvovaginal candidiasis. But we have to consider that in the case of candidemia, we don't use this posology, this dosage, but we use this one 400 or higher posology of the drug. So it's the same microorganism which determine the vulvovaginal candidiasis, and is the same in blood. So we need to expose a very effective level, plasmatic level of the drug. On the contrary, we have the higher risk to select fluco-resistance strain, and this is what we have observed and Marchand described more than 10 years ago. So the risk of Candida albicans vaginitis due to fluconazole-resistant strain was considered rare, and now is not only emerging problem, but an emerged problem. And this is a problem in all patients which had fluconazole consumption in the previous 6 months. On the contrary, when we use for a simple infection like the vulvovaginitis due to Candida, a topical drug, a very effective topical drug as fenticonazole, a higher rate of microbiological efficacy in not only vaginal candidiasis, but also in trichomoniasis and the mixed infection. And we know that on the basis of this study conducted by Varaldi and Milani, that intravaginal fenticonazole is at least effective as clotrimazole and show similar efficacy of miconazole, but is effective also against other agents. It has trichomoniasis, Gardnerella vaginalis, and bacterial like Staph aureus, Strepto, and Escherichia coli. And usually all big and little study conducted about the clinical efficacy of the drug generally observed a very fast efficacy in a few days, but starting the treatment. But we have also other added value of the drug. In this study, old study, but very, very classic and elegant study, was the activity and the presence of the drug after 5 days of vaginal application was evaluated, and was evaluated not only in the mucosa, vaginal mucosa, but also in the urine and in the fecal elimination. And so we can observe and conclude 2 very important elements. The first one, after 5 days of application, we have a very important presence and persistence of the drug in the vaginal mucosa. So one administration of the drug guarantee a very long-lasting activity on the mucosa. There was not a very important urinary elimination, you can see, but very important, there is an anecdotal, substantial negative presence, elimination, presence of the drug in the stool. And this is important because the study confirmed that there is not an important role in the perturbation, not only in the vaginal microbiota, but more important also in the intestinal and gastrointestinal microbiota. So we have also to consider that fenticonazole have to be proposed as an alternative to systemic antifungal drug to treat simple infection. And we can make it by the empirical approach due to the very large spectrum of activity, and we can obtain same results with a systemic treatment and not good prescribed systemic treatment which amplificate the risk of selection of resistance, and so the risk of not responsive form of vulvovaginal candidiasis. And so we can consider, as we conclude in our paper 2 years ago, consider fenticonazole as the milestones for a real approach and for a real anti-fungal stewardship, well used, appropriate and prudent use and wisely used of the antimycotic, and is a very, very important investment in the case of preservation of activity of an old class of drug like azoles. So fenticonazole, the investment in the fenticonazole can contribute in very strong to the maintain of sensitivity of the strain to the azole class in those cases which need a systemic treatment of the infection. We have to consider fenticonazole as I told you, an imidazole derivative with a very broad spectrum of activity, not only antimycotic activity, but also antibacterial and anti-trichomonas activity. By the antimycotic point of view, the activity is based on a unique mechanism and ways. And very important to stress the concept of a unique, typical only of fenticonazole antimycotic mechanism. And as I told before, by inhibition of the secretion of aspartate proteinase acid by the Candida albicans, by damaging of the cytoplasmic membrane, and blocking the cytochrome oxidases and peroxidases. The fenticonizoles also be shown an antibacterial action, an antiprotozoal activity, and so for this reason, the molecule is a very important option for the treatment of mixed infection. The activity of fenticonazole is clearly demonstrated both for mycotic infection and bacterial infection. But the importance is that the fenticonazole has the highest activity at the typical vaginal normal pH, an acid pH near 4.55. And this is a characteristic and an exclusive characteristic because it's not possible to demonstrate in the case of the typical topical comparator. For the case of inhibition of synthesis of aspartate acid proteinase, this is a very important key mechanism, because this activity blocks the enzymatic activity of the candida, and the mechanism of the block and the inhibition of the secretion of protease acid by candida albicans determine a reduction of formation of hyphae and pseudo-hyphae, because we have to remember that candida is a dimorphic fungus, and as a dimorphic fungus, in the case of the spore, the blastospore is a not pathological form of the candida, but the pathological form of candida is when the fungus produces the pseudohyphae, which allow the penetration in the mucosa, also in the vulvovaginal mucosa. And this activity of penetration is strongly linked to the expression of activity of aspartic protease. And by the inhibition of this aspartic protease activity, we have a clear reduction in the symptoms and the clinical aspect of the vulvovaginal candidiasis. And these characteristics, I underline and I repeat, is not typical and is not present in other azoles derivative. So is a typical aspect of fenticonazole, but not for miconazole, fluconazole, ketoconazole, and so on. The effect of fenticonazole on the secretory aspartic proteinase is studied in comparison with another typical comparator, the econazole. And the inhibitory effect is specific, is not mediated by inhibition of fungal growth, and these results confirm this fenticonazole unique property and characteristics. So we can consider a very important number of studies. We confirm these characteristics. And the inhibition also of the aspartic acid proteinase allow also the inhibition of adhesion of the candida on the vaginal mucosal. So there is not a spread in the mucosa, but there is a very difficult adhesion to the mucosa. So we can realize with this drug a very competitive contrast of the not only the growth of the fungus, but also the possibility of exert its pathogenetic activity to the vulvovaginal candidiasis. And in the case of the same studies which I previously showed you, I suggest to consider the first histogram, which represent the persistence of the drug after 5 days of administration. We can consider a drug which continue to exert a typical and exclusive mechanism, which I described you in the previous slides, and also this activity persists for a long time, also after 3 and 5 days, there is a recovery of the drug in the mucosa. We have remember the not only the activity against fungus, but also the activity bacteria and trichomoniasis. This activity is typical. We can observe in part in other topical comparator and competitor of fenticonazole, but the activity in the case of fenticonazole is very strong, showing a very low level of minimal inhibitory concentration of the drug confronting to the other topical treatment. And this is observed also in the gram-positive, gram-negative, and anaerobial population, as the case of bacteroides, which is represented in this old but very important study of Jones about the microbiological characteristic of the drug. This additional activity, antibacterial activity, has to consider for the treatment of bacterial vaginosis, and we can consider fenticonazole as the probably unique option of monotherapy for mixed infection, because we can consider not only the antimycotic activity, but also the antibacterial and trichomoniasis activity of the drug. By the point of view of an infectious disease specialist like me, it could be the master and the goal and the golden standard to define and determine a microbiological diagnosis. But the problem of microbiological diagnosis is a problem in all the world, not only in several countries, but in all the countries. There is a low level of microbiological diagnosis. And in that case, we have to consider that we need a very effective drug for the use in empirical and without the proven of the infection. In the case of fenticonazole, we have an excellent activity against bacteria, against trichomoniasis, and we have an excellent activity against albicans and not albicans cancer. And I to you what is and why we have an excellent activity in the form of non-albicans strains, and in particular in the case of Candida glabrata. So by this point of view, the guidelines for the treatment of infection sustained by Candida, published in the Clinical Infectious Disease in the 2016, there is for the first time the warning about the role of Candida glabrata in the case of vulvovaginitis, and we can observe that there is a suggestion for the treatment which are not comprising fenticonazole. So we need probably to obtain new data about the efficacy of this drug confronting to the other competitor and comparator. In conclusion, based of the very broad spectrum of activity, the maximal activity pH4, the detection of the drug for at least 72, but also at the 5 days of administration, the mechanism of action, typical the inhibition of acid proteinase, and the optimal compliance, we can consider that fenticonazole is effective for treatment vaginal infection and minimizing the risk of drug-resistant strain selection and avoiding disturbance of the intestinal microbiota. And we have seen what is the role also of the microbiota and the need to maintain the homeostasis of the microbiota. We consider very important the use of fenticonazole as a gold standard for the topical treatment of simple, also for the favorable ecological impact of this drug. And also, we have to consider the absence of systemic side effect and the low rate of dropout in the clinical study with the focus on fluconazole, because fenticonazole is a very well tolerated drug for the treatment of vulvovaginal infection and candidiasis. It's important that we consider that it is not absorbed at the systemic level. So we have the very low probability to select resistant strain to the azoles. Fenticonazole is a good topical antifungal drug, not for fungal, not only for fungal infection, but we can propose the drug also for mixed infection. Of course, we need to define better and recommend a different approach by the guidelines, because we have indication in the treatment of infection with a higher level of variability of dosage of the drug, and this different dosage, 100, 150, contribute to the selection of Candida resistance strain and the not only Candida non-albicans, but also Candida albicans resistant strain. And this is the problem not for the future, but this is the problem that we have to manage now, not only in several countries, but in all over the world. Thanks for your attention.